Hello, good morning, everyone. Today episode, a 5 series of national talk on the topic stress management during pandemic. The virtual series of national talk, it is organized by the Fit India Campaign Committee and Fit India Club, Manipur University, as a part of Fit India movement during COVID-19 second wave pandemic. Well, in this occasion, let me welcome each one of you present over here in this session. First of all, I would like to extend my warm welcome to the panelists. First, respected Dr. Lenin Singh, Professor and Head, Department of Psychiatry, Regional Institute of Medical Science, RIMS, Manipur, Imphal. I welcome you, sir, as a speaker, and I thank you so much. I thank you so much for your kind accepted our invitation to be present here as a speaker. Thank you so much, sir. And respected Dr. Laimayung Besnath Sharma, Dean Students Welfare and Chairman of Fit India Club, Manipur University. I welcome you, sir, as a moderator for this session, sir. I welcome you, sir.
Thank you. Thank you.
Respected Dr. Salam Sanjikumar Singh, Assistant Professor, Department of Statistics. I welcome you, sir, as a co-moderator for this session, sir.
Thank you, sir.
So, especially I would like to warm welcome all the participants, learned member, faculty, non-teaching staff, students, all the viewers and listeners, everyone. I welcome for this session. And especially, I would like to welcome Mami TV team also as a media partner. I welcome everyone. So, for moving ahead the program, I request today for moderator, Dr. Salam Sanjikumar Singh, Assistant Professor, Department of Statistics. Please highlight the brief profiles today's speaker, Dr. Lenin Singh. Please, sir.
Thank you, Dr. N. Santosh Singh, convener of this national talk series on COVID-19 pandemic. It is my great privilege opportunity to introduce today's resource person, Dr. Lenin Singh, Professor and Head Department of Psychiatry, Regional Institute of Medical Sciences, RIMS, Imphal. As we know that Professor Lenin Singh is from Manipur. He is a psychiatrist by profession who has passions to serve community to facilitate healthy and happy lifestyle among the common people. He now serves as a professor and head in the Department of Psychiatry, Regional Institute of Medical Sciences, Imphal, Manipur. He received his MD, that is Doctor of Medicine in Psychiatry from AIMS Institute of Medical Sciences, New Delhi, India, and was awarded his PhD degree from the Department of Anthropology, Manipur University. He has been as a postgraduate research and guide for modern times, and being a PhD psychiatry examiner for various universities and medical institutions in the country. He published more than 23 scientific articles on national and international journals and presented at national and international conferences. He had served as an honorary secretary of the Indian Psychiatry Society, Eastern Zone and France. In addition to serving as secretary of the ARIMSA, that is Association of RIMS and Amalai, he also served as an honorary secretary of the Indian Psychiatry Society, Manipur, France, for a long period of time. From the early beginning, he has been affiliated to different capacity with various organizations, associations, and societies like Medical Society, RIMS Imphal, Medical Education Unit, RIMS Imphal, Lions Club International, Indian Medical Association, Manipur State Branch, Board of Studies of Medical Sciences of Manipur University, and Subcommittee of the Indian Psychiatric Society and the Red Cross Society in Pakistan. Besides being a physician and a teacher in a medical institute, Professor Lenin Singh has also been working and handled more than 10 different research projects and programs. Currently, he is a nodal officer of RRCC, that is Regional Resource Coordinating Center, and the DTC, Drug and Prevalence Imphal. Of the recently conducted national mental health survey to the Ministry of Health and Family Welfare Government of India, he was the principal investigator of the state. Professor Lenin Singh also takes a keen interest on writing books about mental health and social issues. He is a regular contributor to articles on local media and regularly presented various talk shows on local TV channels, Fun and AR Fun. He has conducted various awareness and educative programs for the school children, teachers, and parents on numerous topics such as stress management, parenting, depressions, examination tips, etc. So Professor Lenin Singh has also been one of the main forces to organize conference of both state and national level in Imphal. So we are fortunate to interact with such a prominent professor of psychiatry during this COVID-19 pandemic. I hope that Professor Lenin will give some tips how to manage stress during this pandemic. So I hand over to our coordinator, Vishwanath Singh, for further session.
Thank you, Dr. Santikumar. First of all, once again, I would like to welcome the resource person of today's series, the virtual series of National Talk 5th series. So, I would like to welcome Dr. Lenin Singh, Professor and Head Department of Psychiatry, RIMS Imphal once again. So I don't think I want to introduce once again because our colleague nicely introduced, but I would like to add one point regarding Professor Lenin. He is a good motivators. So a lot of motivation speech we have heard from him. So I thank Professor Lenin for just share with me this particular topic, stress management during pandemic. So dear participants, as per allocation of time, so we have given the 40 minutes to the speakers and 10 minutes for the interaction session, question and answer session. So I will not take much time. So I think our speakers will talk on the stress management, particularly on mental stage. So stress management is a very big areas. So I think our respected resource person will confine on the mental stress management during the pandemic. So dear friends, the participants, our resource person is on the line. So I would like to invite our resource person to take your time. So over to Professor Len.
Thank you. Thank you very much, Sir Santos. At the outset, I would like to welcome everyone from my end also for giving me this opportunity to be one of the speakers in the virtual series of National Talk under Fit India movement organized by Manipur Universities. I am always attached to Manipur University in some way or other, and it is my second institution, so to say, next to my beloved institution, Regional Institute of Medical Sciences. At the outset, I would like to thank our co-convener, Dr. Salam Santikumar, for your kind words and for introducing me to the this one, August House today. And I would like to pay my regards to today's moderator, respected Dr. L. Vishwanath Sharma, Chairman, Fit India Movement, and all the listeners, all the participants today. As I'm told, I would like to concentrate mostly on the impact of the psychological and the mental aspect given by the pandemic of recent phenomenon. To begin with, I would like to dwell a little bit on what is stress and what are its manifestations and how it is harmful to our physical and psychological health. Then I will go to the pandemic, and then mostly I will go for the management tips. And ultimately, stress management, if it is unable to handle, we have to rely on the psychologists and the psychiatrists for their expert opinion and intervention. And before that, the importance is how do we define, how do we identify, how do we take precautions? That is most important in today's time. So with this in my mind, I would like to proceed my presentation. My topic is stress management during pandemic. Modern world is a world of stress and tension that I need not re-emphasize again, because the workload, the timelines and the number of activities we would like to do and the priorities collide with each other, and 24 hours a day seems to be not sufficient for most of us. So we become so frustrated at most of the time of the day. The word stress was originally used by Hans Selye in 1956 to describe the pressure experienced by a person in response to life demands. What are the life demands? It might vary from one person to another, but there is a saying that there is no life without challenges. If there is no challenge, there is not a life. But the problem is, how do we face these challenges and come out successfully? So in this regard, Hans Selye again explained that stress is a process of adjusting to or dealing with circumstances that disrupt or threaten to disrupt a person's physical or psychological functioning. So basically it is adjustment. There is also a saying that survival of the fittest. So far we are fit. Why? Because we are surviving. Those surviving people have the capacity to cope with the tensions and stress come across day in and day out in our life. So when we break down, then only we will have mental illness. Otherwise, we are mentally healthy. Stress is tension, otherwise, strain or pressure, whatever you want to call, from a situation that requires us to use, adapt, develop new coping skills. When the pandemic is not there, we are coping very nicely, but the sudden unexpected impact of this magnitude of pandemic, then we are at a loss. How to cope with this? That creates more stress than the usual stress we are facing day in and day out before. Let's see, this glass of water is not that heavy. Anyone can handle it, even a child can handle it. Imagine you are holding the glass of water. If you hold it for a minute, it is not a problem. If you hold it for an hour, your arm will hurt a bit. If you hold it for a day, your arm will feel numb. Maybe it is not possible. The weight of the glass does not change, but the longer you hold it, the heavier it becomes. The stresses and worries in life are like that glass of water. The more you hold on to them, the more they affect you. The more you hold on them, the heavier it will become. And even a single stressor may break a person. The underlying idea is sooner you ventilate it, sooner you cope with it, sooner you share it with someone, better will be the impact of a stress, whatever magnitude it may be. So keeping it inside, that is the problem. Let's not keep stress within ourselves. That's come the role of family, friends, and our society. Society, in a way, in a big way rather, is sharing our stress and strain in a different way. When we talk about stress, there are two terms coming up. One is stressor and another is stress itself. Or what are the stressors? Stressors are the stimulus or the stimuli precipitating a change. Means there is a demand, or there is an illness, or there is someone died in the family, or there is exam coming up, or there is this one, a blast in the community. These are stressors. And the result of that stressor is called stress or tension. So what are the stressors? We can talk from different angles, like it may be a physical stressor, it may be a mental stressor, or it may be perceived stressor also. It may be not real. Sometimes even the unreal stressors are more difficult to handle. Say, for example, in our environment, we are talking about global warming and noise pollution. That is very common in this small town of our Imphal itself is badly affected with noise pollution, air pollution, radiation by the electronic gadgets, which has been disposed indiscriminately, and diseases of different kinds like infectious diseases are coming, including these pandemics, and bright light, difficult terrain, or lack of drainage. I'm just giving some examples which are very close to our day-to-day life. So these can also give stress. And physiologically, like sleep deprivation, when we are playing mobile all night and not sleeping the days together, how much stress it will give to us next day. Dehydration means you are working under the sun and not taking enough water. That dehydration itself will give lots of stress in your body and the mind. Fatigue, impaired immune system, that you are very weak. Say, for example, you are a post-organ transplant patient, or you are taking immune suppressants, steroids for a long time. That is also a stressor. Overuse and underuse of muscles. Like most of the time, very few people are overusing, and majority of us, so-called white-collar job people and we people in the universities and institutes, are underuse of our muscles and organ systems. The sedentary habit, this itself is giving lots of stress and causing illness and injuries as well. Mental stressors are also there. This is in the mind, that excessive information we do call now infodemic, that this during this pandemic, the informations are coming from left and right and from everywhere, say from locality by word of mouth and from media of different source like social media and formal media. These are very, very what you call disturbing images, disturbing news are coming every day, every moment. Sensory overload it might cause, or sensory deprivation, say for example people in the jail. Uncertainty and isolation, these two are also very, very big stressors. We don't know what will happen to this pandemic tomorrow, or will it worsen. This sort of thing will give lots of stress. And in the management of COVID, we are talking about social isolation. That is a very, very productive sort of a term we are using. We better use physical isolation or physical distancing, but if we are socially isolating ourselves, mentally isolating ourselves, that will definitely lead to depression and other stressors. Time pressure versus waiting. When you wait, time is so long, and there is time pressure that during this talk I have to complete in 40 minutes. That itself gives me a little bit of tension. So these are some of the examples. Unpredictability, and then hard choice or no choice. If there is no choice, that is also a stressor. And there are many choices. For example, after we pass 12 examination class, 12 class examination, we are at a loss in what direction I have to go for engineering, for academics, for research, or for law. This is also giving lots of stressors to our youth. These are some of the examples. Emotional things are also there. For example, bereavement. Nowadays, we are talking about bereavement during this pandemic. Loved ones, we used to serve them at their last moment, but now we cannot. Directly, he goes to the hospital, then goes to the ICU. We cannot go there. And then one day it was declared that so and so, our beloved one, is no more, and then we cannot see him again. He will be taken to a public crematorium, and without any rituals, he will be done away, his body. So this will give grief, which is far more greater than the previous one. In the previous one, we have some consolation that we have done enough for my loved ones, but today we are feeling that we have done nothing for my beloved one. So that's increasing the grief. And this is also one thing coming up emotionally in a big way in our society today because of the pandemic. Resentment, anger, and guilt, this is also a killer of the modern society. And this is giving lots of stress, and that is giving lots of impact on our organ system. Boredom, nothing to do now. We are locked within the four walls of the house. So many children are so bored that they become delinquent and they are not doing productive activities. They are irritable. Interpersonal relationship, case stressors, source of stressor. For example, in the university itself, in a one department, if all the faculties gel together very well, that is the best department. But it does not happen in all the departments. Sometimes the different faculties or staffs, they have differences and interpersonal problems, and then thereby lots of tension in the workplace also. So there is now a different discipline to deal with the workplace stress. Life events like death of a loved one, or even what we call the very joyful event like marriage and the childbirth. This is also highly stressful, and because of the adaptation required for the new environment and the new people around us. So there are no dearth of stressors. But when we talk about stress, we always think that stressors are negative, in the negative connotations. But no, stress can be of two types, or in other words, a little amount of stress is beneficial for health and our productivity. Please see here, the positive stress. Oh, I have heard positive stress only today. Maybe many of us will be thinking. It is known as eustress. Eustress or positive stress occurs when your level of stress is high enough to motivate you to move into action and to get things accomplished. For example, I will give an example of the upcoming examination. We are relaxed for the whole year, but when the exam is next month, then we tighten our belt, we can start concentrating more, and we start working more hard, and we consult each other and inquire with the beloved teachers and prepare for the exam. That is eustress. That is a good stress. That is a positive stress. But at the same time, for some students, they are so worried, they are so scared of the upcoming exam, and they feel that they will drop the exam and they will appear in the next term. That is because of the negative stress or excessive stress. The exam is the same, as I said before. The glass of water is the same. The weight of glass of water is the same, but the holder, how long he keeps it and how he looks at it will make the difference. So the same example of upcoming examination may be good motivator for some, thereby it is a positive stressor or eustress. And for the another patient, student, that will be too much for him because he cannot accept it and he cannot adapt it and he cannot deal with it. So it has become a negative stress or distress, means it will be a problem for him or her. So it is not only on the stressor, but it is an interaction between the stressor and the individual. If the individual can handle it, then it is fine. If the individual cannot handle it, that is the problem. Say, for example, you are the head of the country, then lots of problems coming up in the pandemic. You might either break down or you might be thinking that it is an opportunity to prove his capability. There is a very good example for eustress and distress. Please see, many of you might be familiar with this diagram. Here, if the stress is too less, means nothing to do, exam is also cancelled, classes are also cancelled, the students are so lazy, they lie down, they sleep. But exam is coming up, then their activity is also increased. So that is called optimum stress, and the productivity is highest peaked. But nowadays the students are giving pressure, are given pressure by the parents, by the teachers, and by the colleagues that you have to excel, you have to achieve the first class, first position, second position. The students try to work harder, and beyond his capacity. Then ultimately he break down. Instead of getting the first rank, he break down and he came to the psychiatric clinic. That is called excessive stress, and that is beyond the optimum stress, and the performance is decreased up to the level of 0, or might need the psychological or psychiatric help. So all of us should be aware that stress is a dynamic term, and stress is an interaction between stressor and the person. So stress remains the same. If we can come out successfully, the changes are to be made in myself or the individual who is going to cope with that stress. It is clear now. Then I don't know what is stress, and I have never thought about stress. And before today, never thought of, I might also suffering from stress. How do I know? There will be some telltale signs, there will be some indicators that will tell that, oh, I might have stress. See, for example, I divide it into 4 domains. First, let's go for the body signals. In the body signals, headache, frequent headache once in a while is everybody has. Frequent infections like today flu, today diarrhea, next day this type of things, and muscular tension, that headache, shoulder pain, back pain, and all sorts of pain will be there. Fatigue, easily fatigue. When I think of going to the office, I started feeling tired. There is a sign of stress. Skin irritations like allergies. You might be surprised to learn that allergies are caused by stress. Breathlessness, shortness of breath is one of the commonest symptoms when the patients come to us, and ultimately it comes out to be because of tension and the stress. Loss of confidence and the more fussy that is in emotion, irritability, depression, anger, anxiousness, and apprehension. These are more irritable. When people are in stress, they are very irritable. We might have seen in the household also spouses that were very very cohesive. When they have 2-3 children, and then both the spouse are working, then starts these conflicts, small conflicts and all that. This is because both of them have stress to cope with the family as well as the profession. That is a very common phenomenon nowadays, and we have to address this. Mind, worried, muddled thinking means lack of clarity, inability to concentrate, nightmares during sleep, then indecision, negative thoughts, hasty decision. These are coming in the mind. Ultimately, body, emotion, and mind will be reflected in our behavior, like accident prone, over or under eating, loss of sex drive, drinking more or smoking more, sleeplessness, and restlessness. So ultimately, all these things one might have come across once in a while in our lifetime. There is nothing but it's an indicator of stress. If it is for short period of time, it does not matter much. But if it is for long period of time, it harms a lot. When response to acute stress, how the brain reacts. The brain from hypothalamus increases the release of ACTH, and that will stimulate the adrenal glands, and that adrenal glands will produce adrenaline and cortisol. These are called stress hormones otherwise also. And immediately what happens, our digestive system activity will be decreased, and at the same time blood pressure and the heart rate will be increased, and this is a preparation for flight or fight response. If it is prolonged for a long time, then what happens? For some period of time, there will be alarm that body will show all those indicators. After that, body will try to resist, means you will try to adjust and adapt for some time. And then if the stress continues and our coping skill is not improved, or we are not taking help from others, then exhaustion phase, and that phase is we are seeing in the form of hypertension, in the form of depression, and in the form of suicide intent. This is almost the end point of chronic stress. And there are heart attacks, and there are asthma, there are allergies, there are irritable bowel syndrome. I will just mention in a while. So stress does not spare any part of our body from top to from toe to hairs. So for example, in the skin, there might be lots of acne, there is pimple, psoriasis, eczema, dermatitis. These are increased or produced by stress, chronic stress. In the stomach, peptic ulcer, irritable bowel syndrome, then the IBD, reflux, nausea. That is stomach upset very frequently. People are suffering. When they look back, they do have an anxiety or stressor. We have a pancreas near the stomach that is the regulator of the insulin, thereby diabetes is controlled. But now India has become the capital of diabetes, and Manipur is also not lagging behind. It is because the stressors will disturb the pancreas and the elevated level of secretions of the insulin. Immune system leads to suppression of effectiveness and causes inflammation, and there will be prone for many infections and the repeated illness. In the brain, mood, anger, depression, irritability, lack of energy, and concentration problems will be there. And heart, what will happen to the heart? Many of the politicians jokingly in their talk, they say that before I become the MLA, I was not having diabetes, I was not having BP, and I was not having all these problems, but now I'm having. That is true. This causes lots of heart problem. Intestine, decreased nutrient absorption is there, reduced metabolism is there, irritable bowel syndrome is there. Reproductive system also, that libido is reduced, and this one, desire for sex is also decreased, and infertility is also one of the outcome. And joints and muscles, lots of aches and pains we observe. Now coming, and these are all common, we are talking about the common issues of the stress. And now we're coming to the COVID-19 and mental health. So during the COVID-19, what is the commonest manifestation is fear and apprehension, sleep disturbance, and many, in one day, there are more than 10-20 calls about from our friends about asking the remedies of the sleep disturbance. Then facing great changes in the adaptability, irritability, boredom, frustration, worried well. What is worried well? They themselves are not positive, but they think and they presume that they are positive, and they are taking excessive care, and they are taking food separately, they are sleeping in separate room, and they are washing their hands repeatedly, and whenever any package, food or otherwise coming from outside, they keep washing. Domestic violence is increased, substance abuse is also increased. This is the outcome of the COVID-19. What are the factors? There are common factors, but some of the factors are worsening the fear and panic during pandemic. There are lack of knowledge about this virus, and the lack of healthy behavior that in spite of the SOPs announced and instructed by the government, that many people are unable or are not ready to follow this, that healthy behaviors. Lack of effective treatment, no medicine which is directly helping is not coming up. Of course, it is there is some coming up in the near future. Mental health facilities are very less, and moreover, many people are not taking these mental health facilities. Economic problem, hands to mouth people are very much worse impacted. Impact of the social media, that infodemic, I will talk about this later on. And quarantine, lockdown, and curfew, these are the things, measures taken up to control this pandemic. This itself gives lots of impact on the mental health and otherwise. Pre-existing comorbidities and COVID-19. All of us know that we are suffering from diabetes mellitus, hypertension, cancer, kidney disease, cardiovascular disease, smoking, organ transplanted, patients, obesity, asthma, and immunodeficiency from any cause, these are more risky in COVID-19, and we should take more care. And when the opportunity comes, we should take the vaccination without hesitation to protect ourselves, whatever protection it gives. Now, coming to the management of stress, and we are more interested in the management rather than knowing what is stress. Now, ABC of stress management. A is what causes you stress, how do you react? B is there is a fine line between positive and negative stress. I have already explained. How much can you cope with before it becomes negative? So it depends on your coping skills. All the negative stress you can transform into positive stress, and it can be on your benefit side. C is control. What can you do to help yourself combat to the negative effects of stress? If at all it is too much, then how do you protect yourself? So there are some hormones also. I said cortisol and all, there are stress hormones. The dopamine, serotonin, oxytocin, endorphin. Endorphin is secreted by laughter as well as exercise also. Oxytocin is called love hormone, and dopamine is reward system. Many people are taking drugs that helps to improve dopamine temporarily. That's why they are taking it to cope with the stress. But there is a wrong way of coping. Dopamine can be produced by different ways, like completing a task, doing self-care activities, eating good food, and celebrating little wins. Serotonin is also a mood stabilizer, and we are supplementing in case of depression and anxiety. What is actually our goal for stress management? To do away the stress or to live a stress-free life? No, it's not possible. Life itself, by definition, is lots of stress and challenges right from the day we are born till we breathe the last breath. Stress management involves controlling and reducing the tension that occurs in the stressful situations by making emotional and physical changes. So it boils down making emotional and physical changes in ourselves. How do you make it? There are many ways. Exercise is one of those. The best thing is called fountain of health. Maybe physical or maybe mental or maybe psychological or maybe stress, whatever you call, exercise is the best. But what type of exercise? Any type of exercise of your choice. Only thing is that you move your bodies, you move your parts. Don't be sedentary, and at least for 30 minutes in a day, every day. And so you can take up any type of movement. We are so sedentary now, we are stuck to the sofas, and so it gives lots of bad impacts. We take it very lightly, but laughter is one of the best way of doing away stress. And you please remember, when you laughed heartily from the heart, now we are having almost diplomatic smiles. When we meet our colleagues, we smile, of course, but that is diplomatic smile. You are not smiling or laughing from your heart. It does not gain, except it does not hurt the other people. Adopting a humorous view towards life situation can take the edge of everyday stressors. Not being too serious or in a constant alert mode helps maintain the equanimity of mind and promote clear thinking. You might have seen some of your colleagues in the institute or in the universities. They are always very much worried and alert mode, anxious mode, and anything they will take it in the negative. There is not good. Let's be on the lighter side of the life. What are the benefits of laughter? Many learned researchers said laughter lowers the blood pressure and reduces hypertension thereof. It provides good cardiac conditioning, especially for those who are unable to perform physical exercise, and reduces stress hormones and increases endorphin, that is the good hormone, that is natural painkiller. Boost the immune function by raising levels of infection-fighting T cells, disease-fighting protein called gamma interferon, and the disease-destroying antibodies called B cells. Laughter triggers the release of endorphin, body's natural painkillers, and produces a general sense of well-being. That is one of the easiest but most rare thing in this modern society. Now coming to the autonomic training, you train yourself to think positively. It's a relaxation technique developed by the German psychiatrist Johannes Heinrich Kluge in 1932. This technique involves the daily practice of sessions that last around 15 minutes, usually in the morning or in the evening. During each session, the practitioner will repeat a set of visualization that induces a state of relaxation. When we visualize war picture, when we visualize a spirit, ghosts, and all that, it will not give relaxation to our mind. If you remember the smile of an innocent child, if you remember the waterfall you have seen last winter, last picnic, that will relax your mind. The technique can be used to alleviate many stress-induced psychosomatic disorders. What is psychosomatic disorder? Most of our illnesses, aches and pains, worries, headaches, and all that are because of the mental issues and reflected in the form of physical disorders. These are called psychosomatic disorders, and this can be managed by this autogenic training. In this autogenic training, restores the balance between sympathetic and parasympathetic autonomic systems. These two autonomic nervous system has two parts. For example, sympathetic nervous systems activated from threatening stresses will cause irritability, anxiety, high blood pressure, fatigue, depression, and muscle tension, all negative. But it will be controlled by each this one brother, that parasympathetic nervous system, that will visualize the positive and the healing images. Breathing will be normalized, and progressive relaxation will be there, and meditation will be there. This will be the calming effect impacting on the parasympathetic, and parasympathetic will cool down the hyperactive sympathetic nervous system. That is the mechanism of the autogenic mindfulness. Now coming to hobby. Are we having hobbies? Yes, we do. We write essays during our lower classes. What is your hobby? Now we have forgotten, and we have never written our hobbies also, because we are grown up now. But actually, hobbies should continue till the last of our life. Hobby is an activity or interest that is undertaken for pleasure or relaxation, typically done during one's leisure time. Collecting stamps, games, no need to mention, but there are lots of hobbies. For example, volunteering in some social work, writing, and blogging, podcasting, marketing, yoga, art, travel, photography, learning languages, or keeping a pet, or gardening. Anything can be taken up. Nowadays, in the modern society, meditation. Many of the Western people who are lost in the material world, they also realize that meditation is required. Very, very simple 5 steps. Find a quiet place, and then sit in a straight back posture, close your eyes and relax. There are 2 thoughts. Another one says that open your eyes and try to concentrate. It is more difficult. Watch your breath. Breathing is very important. When you are angry, your breath will be very fast and strong. But if you control your breath, it will reversely calm yourself. That anger will be out. Similarly, if you can control over your breath, you can control over your emotion. Detach and let go of the thoughts and concentrate on a point, and that is a good point, and relax, and relax. What are the benefits of meditation? Enhancing self-awareness. Build a strong relationship with yourself. We usually do not love ourselves. We usually despise ourselves. We do not have the confidence on yourself. If it is over, that is also not good. That ego will come. Overconfidence is very harmful, but underconfidence is also not good. Boost happiness. Meditation will increase happiness. You will smile after you do meditation. You will not sulk. Sharpen your focus, and even you are a student, you will learn more how to discipline your mind and focus on your study, and helps with stress reduction, natural method to relieve stress. And even it is used nowadays to control substance abuse management. Now another term has come that is called mindfulness. Are we mindful? Yes, our minds are full of clutters. There is not mindful, but what we want is mindfulness. Mind your mind. So mindfulness means paying attention in a particular way, means living in the now and the here. Not yesterday, not tomorrow, but living in now and here. So mindful breathing is whatever you are breathing, you concentrate on that. Most of the time we are not aware of our breathing, but breathe consciously for some time. What are the health benefits? It reduces stress, increases relaxation, and reducing blood pressure. Similarly, mindful eating. Are you eating mindful nowadays? You have lots of spreads in your dining table. You are eating very absent-mindedly, and your thoughts are somewhere. Your thoughts are in the university. Your thoughts are somewhere in the marketing mall, and you are taking very mechanically, and sometimes very salty foods are also not recognized, and you have taken it. So much so unmindful you are during eating. That's not good. And mindful yoga, similarly, when you do yoga, you have to mindful of that during yourself and your yoga. Body scan meditation is also another. And then come deep breathing exercise. As I said, breathing is closely related to life and our well-being. So there are a very small technique which anybody can take up. Please see here, breath in, taking about counting 5 times. Please breathe in 1, 2, 3, 4, 5. Hold it for 5 times, 5 counts, like 1, 2, 3, 4, 5. Similarly, breathe out and hold this cycle, counting of 5. Repeat it morning, evening, and for after some time you can count up to 6, 7, 8, 9, 10. So this type of breathing will increase the oxygen concentration in the lungs and brain, and so your relaxation will be better. Progressive muscular relaxation therapy. This is done or taught by the clinical psychologists, or there are many YouTubers we demonstrate very nicely also. You start from forehead and you end to the toes, and you consciously contract and then consciously relax the muscles involved in these different parts, starting from forehead, cheeks, shoulder, lower back, and all. It is also part of the yoga. If somebody is practicing yoga, it is also part of it. Positive thinking, nothing like that. What are the benefits of positive thinking? Who are now practicing positive thinking? It's very rare, very difficult to answer. If you think positive for everything you come across in life, it will increase lifespan, it will lower rates of depression, it will lower rates of distress, greater resistance to common cold, and better psychological and physical well-being, reduced risks of cardiovascular disease, better coping skill during hardship and stress. So nothing is bad. If you do positive thinking, you will survive in a way. Imagery. What is imagery? Your imagination. If you always imagine bad thing will come. That the what you call impact of your thought. You always think of this one. Power of positive thinking. There is a book also. So similarly, imagery also you are utilizing the same. You imagine the good thing, then good thing will happen. So guided imagery relaxation can help healing, learning, creativity, and performance feel more in control of emotions and thoughts. It helps improve attitude and health and sense of well-being. How do you do that? Sit comfortably, take a few deep breaths, and picture a few peaceful setting. So whatever peaceful setting comes in your mind, you imagine. Imagine a scene, 8 details, not only the this one scene, you add there the color, the smell, and then the emotion attached to it, the birds flying, the winds are breezing, and the good flowers smells are spreading, that sort of thing. And then you relax and you lost to that scene, you enjoy, and how beautiful emotional feeling you have. You try and see. Joy for decluttering. Most of the time, our house, our rooms are full of clutters. That gives lots of stress. Please compare these two. The above one is before decluttering. It is all spread everywhere. See, it is also known as husband's hostel room. I mean, this one, this unmarried boys, their hostel rooms are like that. But below, the same thing has been nicely stacked, and so it gives a clean and very nice sense of pleasure to the eye, and it will cool down your stress. Okay, coming to this WHO, this one. So it is little congested. I will take up some of the points. Coping with stress during 2019 novel coronavirus outbreak. Okay, it is normal to feel sick, sad and stressed, confused, scared, or angry during a crisis. Talking to people you trust can help. Maybe doctor, maybe your friend, maybe your spouse. Contact your friends and family. That is the response. Number two, if you must stay at home, maintain a healthy lifestyle, including proper diet. Proper diet does not mean always balanced diet because nowadays it is not available. Properly cooked and unstalled with fresh food. Sleep, 7 to 8 hours of sleep. Exercise and social contacts with loved ones at home and by email or phone with the other family and friends. This also echoing the same thing we are talking about right from since morning. Number third, don't use smoking, alcohol, or other drugs to deal with your emotion. That is called wrong way of coping. If you feel overwhelmed, talk to a health worker, psychologist, psychiatrist, counselor, have a plan and where to go to and how to seek help for physical and mental health needs if at all required. Ah. Sorry. Next is get the facts, gather information that will help you accurately determine your risks so that you can fake you can take reasonable precautions. Find a credible source you can trust, such as WHO website or local or state public health agency. That's what we are talking about infodemic. There are lots of informations and it is very difficult to find out which one is correct, which one is wrong. Limit worry and agitation by listening to the time your family spend watching or listening to the media coverage that you perceived or is upsetting. You avoid them and you relax with the this one humorous programs or other not related to COVID-19. Draw on skills you have used in the past that have helped you to manage previous lives of adversities. And in our life, at certain point of time, we might have come across loss of near and dear ones, a sickness, some people suffering from cancer, diabetes, and all that. How do you cope with that? The same formula you try to apply now also. Now, WHO has specifically given some instructions about the helping the children. The stress and tension we are having, the children are having more and or rather in a different type. Children may respond to stress in different ways, such as being more clingy, anxious, withdrawing from the parents, angry or agitated or bedwetting, etc. Response to child's reactions in a supportive way, listen to their concerns and give them extra love and attention. Quality time is what we use to talk. Just near with them where you are cooking or you are reading newspaper and they are playing around, that is not giving quality time. You listen to them, you devote a particular minutes, 5 minutes, 10 minutes to them, and then you listen to them and give wholehearted importance to the discussion you are with your children. That is very good. If separation occurs, for example, hospitalization, ensure regular contact via phone and the reassurance. They are very much worried and scared. And play. There should be an opportunity for play. Even in a small family, you play with your children, which may be possible. Preferably the physical plays, but if not, you can play Ludo, you can play Carom, you can play hide and seek or whatever. Keep the regular routine and the schedule as much as possible, like teaching, learning, it should not be forgotten, like if it is online class or you can teach them if it is young children. Provide facts about what has happened. Don't hide. They will be more scared if you hide, but interpret it in a very easy way, in such a way that they understand the things happening. Some of the young children do not understand the meaning of death. and so it is our responsibility. Top tips. I'm taking only 3 minutes or so. Please excuse me. For navigating infodemic. Excuse me.
Yeah, please continue, sir.
Can I take?
Please continue. No, yeah,
Okay.
please continue, sir.
Thank you. Thank you. Number one, assess the source. When I look at the social media or digital media or print media, you can try to confirm the source. It is by XYZ like me, then don't rely. It is by WHO, Government of Manipur, then you rely on that. Number two, go beyond headlines. Sometimes the headlines are made in such a way that it is very sensational and provocative. But when you go down inside, the things are very simple. And number three, identify the author. Who is writing this? And there are many times any XYZ can also write in the paper. So if the author, I'm not despising any of such write-ups, but for our safety or emotional safety, we should think about who is the writer. Say for example, there are many instructions, do this, don't do this to protect COVID, and many people are blindly following. That is very dangerous. Number four, check the date. And nowadays, the Second World War pictures are also coming up today as if it is for today. And the people are so scared. And later on, it comes out that it was a very, very old video like that. No, so please check the date and examine the supporting evidences. How he is saying it is a research work, or it is just a hearsay or words of mouth. Next is check your biases. Think about whether your own bias could affect your judgment or what is or is not trustworthy. So regarding vaccination, there are lots of positive as well as negative statements flying around, and it depends on your perception, which one you like. If you are a negative-minded person, you will never go for the vaccination side. Otherwise, if you have the means that a straw is also a big means when a drowned person. So whatever good thing is available, you go and get it. So that is your attitude and judgment. 7, turn to the fact checkers. You check whether it is really means you may compare or you may consult international fact-checking network and global news outlets focused on the debunking misinformations. So these are some tips about doing away with the infodemics. As I have also mentioned before, there are very easy but wrong way of coping with the stress. For example, smoking. For example, drinking. So by doing that, you will be relieved for a while. You will be happy. You will be smiling. You will be talking. But it is temporary. And after beyond some time, it will repercuss. It will be having more impact. Not only the stress, but the harmful effect of the drug will come. But the positive side, now we are threatened, sort of our living is being threatened, livelihood is being threatened. So what are the most important things that in fact, you might or might not agree with me, but I think the following are very, very important today. This pandemic, we cannot avoid and do away. So why should we deny? Why should not we accept it? That it's a big challenge. Of course, it's a challenge. We accept it. Without accepting, how can you proceed to control it? If you keep denying and the leg pulling and accusing some people, it will never solve the problem. Then hope that Viktor Franklin had once done this one experiment in the concentration camp of the Second World War. Those people who survived, what was the what was the main thing of their survival was nothing. Their physical health, their relationship, etc. Nothing. It was hope. If the person believes that he will be able to overcome, those are the people who survive. So now the time has come. We should have hope to survive this pandemic. And you should love yourself and you should have confidence. If you don't love and you don't confide yourself, then who will love you? And you should have the feeling that will to survive, and you should have the willingness to survive. There are many examples that cancer patients, those are not having will to survive, they die before the predicted time of 6 months or 1 year. But those people who are willing to survive, they survive beyond 6 months to 6 years. That is, living examples are there. Helping others is a very good. It will give you very reward. This thing and this one, dopamine will be released when you help someone rather than seeking help from others and taking responsibilities of yourself, at least not for the others. Your masks should be properly used, and your hand hygiene, face hygiene should be properly used, and you should not go to the crowd. This much responsibility we can take. And spirituality, at the end, it is the source of love, it is a source of energy, it is a source of power when the human beings fail. And so I think I'm not talking about religion. Religion is up to our choice, but spirituality is good for everyone. That is truth, only truth. So now for stress management, what we must do is creative imagery is very good. And thought stopping, if it is a wrong thought, please stop it. Breathing exercise are very good. And then regular exercise, physical of any type is very good. Proper nutrition is very good, helpful. Relaxation, response, and quiet environment, passive attitude, and comfortable positions. And self-hypnosis that I have not included in my talk. Time management is one. It is not only during pandemic. And biofeedback, there are mechanisms now in the relaxation therapy in the clinical psychology department. That is, it tells you whether you are relaxed enough or not. If not, you increase. Meditation, of course, it is the in thing now. Yoga is also in thing now. Group or social support each other, like we are doing Fit India movement. We are supporting each other today. In today's gathering, we are helping each other. So these are some of the activities which will do away the anxiety and stress of whatever it comes in our life for this time, this pandemic. But maybe next time some other things might come. But these formulas will always exist, remains true, and we must survive this pandemic. That also happily, not crying and not bowing down. We have to hold our heads high, and we have confidence that we will be able to defeat this pandemic, and collectively we will win. Thank you very much. So enjoy life as it comes. Don't worry for future, and always be happy. Thank you so much for active listening.
So thank you, Doctor. Now we have listened a very beautiful lectures on the stress management. So now this lecture is almost 102 participants is listening these lectures. Then we also have got some queries, some questions. So shall we invite the other question also? So we have only 4 or 5 questions right now. Shall we invite, Doctor?
Yeah. Shall I stop sharing the screen?
No. Yeah. Okay. No problem. No problem.
Yeah, please take up the questions.
So we have around 4 or 5 questions. I just read out the one by one.
Okay, please.
One Kanguzam Ronald Singh, he asks like this, sir, how to deal with the narcissistic mother who has been controlling me from early childhood till now. She become more controlling during this pandemic, both to me and my wife, which I become so aggressive. Is there any solution to cope with it, or shall I leave her for the betterment for our future? Something like that. This is the first question. And
Kanguzam, what is the name, please, sir?
Kanguzam Ronald.
Okay.
Ronald. This is the first question.
Okay.
And another. Yes. What can we answer the one by one, or we can? I just read out the all
one by one.
Okay. Please. Please.
So that my memory is very short.
Yeah. No. It's all right. It's all right.
Kanguzam Ronald, don't be disappointed. It is happening in many families. It includes the interpersonal relationship problem. And in our family, we are at a juncture where we cannot forget the old tradition. And also we are in the midst of accepting the new generation, like independent nuclear family. We are neither nuclear family nor extended family, and we are mixed up. Now, we still have the tradition that we have to follow our elders, whatever they say, whether truth or whether it is right or wrong. That is what we are taught during childhood. But sometimes they are also human beings, mother or father or any elders, they are also human beings. Sometimes they might have weakness, sometimes they might have a wrong attitude. So if we bow down in this wrong attitude, the whole family will be going in the wrong direction. So we should bring it, we should try to convince mother or father or whoever it is that up to certain extent it is acceptable, but beyond that it is not good or healthy for all of us. But the most important thing is how to approach. If directly argue, then it will irritate her more, and the frustration will be more, and there will be chaos in the family. So sometimes you might require the help of a professional, but the most important thing is that she will not agree at all the name of psychologists or psychiatrists mentioned, because they have a very, very wrong concept about this profession in her age. So maybe you can take help of relatives. Maybe you try in a small way to convince and defy at certain point of time if it is going to harm your happiness and the happiness of the family and your spouse. I'm not saying that you confront, but of course it's a confrontation in a different way, basic way. So it will need some tactics and technique. So if your mother does not want to go to the professionals, you have to go. You have to go and learn, and this is a source of a big stressor. And to cope with this, you need some coaching.
Right. Sir, yeah, thank you, sir. The next question is coming from Tem Ramju. He asks like this: can COVID-19 worries cause obsessive compulsive disorder? If then, what are the measures to be taken up to deal with anxiety and OCDP?
Thank you for this question. I miss rather. OCD is obsessive compulsive disorder. People have an obsessive thought that is against their will. This is ego dystonic. Means he completely understands that whatever he is thinking and doing is wrong. Say, for example, washing his hand 100 times a day. He also knows that people do not do this. People only wash 10 times a day. But why he is washing 100 times? He knows, but he cannot resist. That is the pathology. And before COVID, there are many people who are suffering from OCD. But during the COVID, there is SOP also includes that proper washing of hands and proper hand hygiene, and using sanitizers, and all these things are also part of the SOP. And those people who are already having OCD, they are very much aggravated during the OCD, during the pandemic. And even new cases of OCDs are also coming up. That is true. And number two, managing anxiety and managing stress are almost similar. Those precautions or tips we have mentioned, they all are true. I mean, in this management of anxiety and this one, OCD. But we need medications for OCD. OCD counseling and taking precaution alone is not sufficient, and it is a very big burden to the sufferer, and sometimes up to the extent that they consider ending their own life. OCD is not to be taken very lightly, and sooner the treatment is given, better the outcome will be, and the quality of life of the person will be increased. So we need some professional help for OCD. Then, of course, anxiety mild, please practice the tips which we have discussed today. If it is moderate to severe, you have to consult a professional. Thank you.
Okay. Next query is coming from one. I think she is a teacher. Thangjam Medha Devi. She asks like this: why does stressful thought tend to develop more post midnight, and how do we cope up with it? And further, she asks, how will manage stress in teaching profession like this during this pandemic?
Okay. Profession specific question. Okay. When someone is depressed, I'm giving an example. Usually the sleep disturbance comes first. I mean, as a presenting symptom to the doctor. When a person suffering from depression, and that's of course with anxiety also, when they come, the first thing they blurt out is, doctor, my sleep is very much disturbed. And then when we look out further, then there will come up the sadness of mood, the lethargy, the loss of interest, easy fatigability, and all these things will come. And then when we ask, they will say first, I don't have any stressor. But when we talk further, then, oh, my mother-in-law usually do not accept me right from the day I got married, sort of thing comes up. And they don't consider it as a stressor, but it's a big stressor. Example. So coming to the point, in a person who is suffering from depression or anxiety, sleep is very much disturbed. And unconsciously, they will be thinking only the bad negative aspect of life and negative aspect of the events around them. So it comes up when everybody is quiet, everybody is sleeping, and then when it wakes up in the midnight, this type of disturbing thoughts comes, and it is double times disturbing. In the daytime, it can be diverted to some other activity or some other dialogue discussion with other friends. But at the midnight, with whom I will talk to? I will talk to myself. That is also talking to self is also a type of form of therapy, and it is also a form of illness. If you talk to yourself only about the negative thoughts, you are not good, you are bad, people don't love you, you are not going to survive, your future is bleak. That is our self-talk sometimes. So that will be reversed, converted to you will always good to everyone, you are loved by everybody, you have a good profession, your children are growing up, they are very brilliant, and you will definitely have a future, good life. That sort of self-talk should be practiced to replace the negative self-talk. That is one way of this one countering it. And of course, this sort of thoughts comes. This is a symptom and sign of you're having some problem inside. So we have to evaluate, and most probably we might have a mild depression or chronic stress or mild anxiety, and thus it is a telltale sign. I have mentioned also the indicators, some indicators. So you please take, madam, as an indicator of something. After evaluation, nothing might be there. It is just a sleep problem. Then we'll give sleep hygiene and some sleep medication, and that will do. But if it happens to have some other problem like anxiety and depression, earlier the better. You can solve it better. Then it will have a very happy, long future life.
Okay, thank you, doctor. And there is also one. Yeah, there is also one. Yeah.
Madam has, she said, madam said, teaching profession she loved very much, but now she cannot teach and see their students, beloved students, and interact with them. She meets a lot. She meets the classroom. She meets the smell of the this one, this thing, pen, ink, and all this, the flowers around the classroom. So she is very much frustrated.
Yeah.
And most probably she is missing her class. So now we are doing on the online classes. One thing everybody is sharing is that online classes are more tiresome and more hard very hard than the actual class. In the actual class is very lively. It is just like a drama, and students will interact, and then we are refreshed by the questions and answers and seeing each other, the body language and all that. So now we are talking to a blank screen, and there is no reaction and emotion.
Right. That is a very problematic.
Sitting in a quiet corner of the room, and all the family has to be kept quiet, and childs cannot also laugh and play. All these things are very stressful. So if it comes in a daily basis, it is very, very tense, I think. We didn't realize earlier that the online classes are so much stressful. That may be one, man. And so one day we'll come back to the normal class situation. And all those tips I have mentioned, hobby and diversion of your work, decluttering your room, and keeping a hobby, and reaching out to the friends and your colleagues and students, making a WhatsApp group with your students and sharing, and other than the academic things like personal pleasantries and jokes and all that will help solve the what called stressful situation of a teacher. So, or you can start writing a book and you can publish after the COVID. That will be the best.
So, sir, I will take up one question from Buddhachandra Longthombam.
Please.
How can I manage sleep pattern during this hard pandemic time? My sleeping cycle seems to have been shift from 10 p.m. to 4 p.m. to 2 a.m. to 8 a.m. Please suggest ways and measures to maintain and manage proper sleep cycle, or do I need to take pills?
Okay. Buddhachandra has put up a very pertinent question during this pandemic because many people have lost natural sleep pattern. In the beginning, what happened is we used to have a particular pattern because tomorrow we are going to go to class or go to work or go to office or this and that. But now we don't have any compulsion tomorrow. So we don't bother about sleeping early so that we can get up in time tomorrow morning. So slowly, people spend more time in watching TV or this one, talking with other friends or family members, or most of the time playing with the mobile phone or a digital device. That will take away more of the time in the night, and then it disturbs the sleeping hour. And then next morning, as I have mentioned, people require 7 to 8 hours of regular quality sleep. So people have to mend up this deficit time. So they sleep in the daytime also. But it is learned that the best time for sleep is during the night, and preferably you sleep before midnight and get up early next morning. So it can be, if once this is disturbed, we can bring it back also, no problem. So what we do is that break it somehow, and in the beginning you might require some medications also, and please stop using mobile phone or watching a very interesting movie or reading a very interesting novel just before sleep. It will stimulate the brain and keep on thinking or pursuing the same line for longer period of time, thereby disturbing the initiation of sleep. So you may take a warm water bath, you take a glass of warm water or milk, and you concentrate on the preparation of your sleep, and don't think of other serious methods like trying to solve problem for tomorrow and all that. That mindfulness is very handy now. Now and here is the meaning of mindfulness. Now you please focus on now and here, and then try to sleep peacefully. Some people say that very light music also helps to induce sleep, and some people say preference of the person depends on whether a very dim light is useful or a completely dark light is useful. It depends. So depending on your choice, you try to correct it, and once it is corrected for a few weeks, then ultimately the sleep cycle will come. That biological clock will take care of the sleep pattern. Thank
Sir,
you.
I think you have answered the one question from Buddhachandra. So I cannot
Yes. Yes.
read the question from my mobile. So I just come out from my room because of the electricity problem.
Internet.
So you have answered
Internet problem.
Can you send the other question? There is also another question from Lenin No, something like that. So I cannot read her question from my mobile.
Okay, sir. I will read it.
Yes, please.
A leukemia friend is least bothered
Leukemia.
on the hardship of life and live life like a perfect normal person.
Okay,
However,
okay.
sometimes it extremely worries the family member that he would be more careful in the way he lived. It is advisable to speak to the person, or will he become more anxious about the disease that he has?
Oh, I can catch the question. That patient leukemia, friend who is suffering from leukemia, is not told about his or her own disorder, and so he is behaving normally and rather carelessly. And the family members are more worried that he should take or she should take more care as he is suffering from leukemia. Now the dilemma is whether, in order to make it more careful, whether we shall tell him or her that this is leukemia. That is a very tricky situation. Let's wait for a while before disclosing the disorder. If you prefer to, then you can try to talk in such a way that these precautions are required to save ourselves, irrespective of whether he is leukemia or not. Every nowadays the mortality analysis tells that not only the comorbidity patients, not only the older patients, but the young patients of 30s and 40s without any comorbidity, like without any illness like cancer, diabetes, hypertension, they also succumb to this disease. So it is a universal precaution. Instead of telling her leukemia or whatever it is, we should insist that we are all taking this precaution. You also please take these precautions prescribed by the government or prescribed by the medical science. That will be a better approach in my mind. Thank you.
Tilok, any other questions you saw?
So one question from Ongam said, sir, any technique to overcome stress for COVID patient?
Okay. Panic COVID patients are this one group of people. Then healthcare workers are group of people. Frontline workers are group of people. And those who are kept in the home isolation, they are a group of category of people. All these people have a common anxiety and panic, but different severity and different degrees are there. So our colleague is asking about the COVID patients. COVID patients have in their mind whether it will become more severe and it will become a threat to his life, whether he will be able to see their family members or not, whether he will be requiring ICU or not. All these thoughts are very worrying and very stressful thoughts, and that is quite natural also. But as we have said, in any situation we have to have acceptance and hope. We should accept that I am sick because of so and so. It's okay, or maybe because of my luck, I have been down with this disorder, even though I don't like it. Nobody like it. Now, what I'm going to do is I have to increase my immunity. I have to stick to my schedules as prescribed by the doctors, and I have to put a positive frame of mind. At this even very adverse situation also, I should maintain the desire to live. I should maintain the desire, that hope that I will be able to overcome. And there are many cases who doctors thought will be losing case, but they come back, bounce back, and they become this one fit to go home. So all these COVID patients should be given hope and regularly talked to by the family members if it is possible, and the patient can respond to that. Even the patient himself also have to think that positive imagery, that now he has recovered, now his status is negative, like that, and also that diversion of his thought, and those, if possible, meditation, yoga, relying on the spiritual thoughts, and then remembering the past happy events, and then deep breathing exercise will be very practical. Deep breathing exercise, because most of the time COVID patients have that respiratory problem and low oxygen levels. So that deep breathing exercise will help. And there are other breathing lung exercise also. They are very simple. You can learn that. It is there in this YouTube also. So these are some of the techniques. And along with the medications of COVID, we can also give medications for anxiety and stress. So people worry that those people who are taking our medicines, they cannot go for vaccination, they cannot go or mix with other medication. No, it depends on the type of medication they prescribe. But so far, they are providing medications in our knowledge. They can be co-prescribed with the anxiety medications. So these are the tips we can give to the people with COVID patients, to the people with home isolation patients, and to the patients who are staying in the COVID care centers. They almost have a similar worries and stress. And one of their worries, if it is a young parents, is about their children who are separated. So from time to time, we should call them, video call them, showing their children are doing well, and let them interact with them also. I think these are some of the possible ways to handle this stress of this category of people.
Yeah, thank you, sir, for your very well answer. Next question is from Okram Perlin. He has said that, what do we do when a loved one has passed in the midst of this pandemic? How can I, and the second question is, how can I monitor my mental health during this pandemic situation, and how much physical workout will help to overcome the anxiety?
Very good questions. 3 questions, all of them are very good. In Okram Palin, something like that. Okay. I have also included in my talk that grief. Now the grief has become taken a different dimension. Earlier during grief period, we used to have social support, and we also feel that we have done enough by doing the rituals. The rituals, the dead soul might not be aware, he is already dead, she is already dead, but all the things which are doing is for our own serenity, to calm down our mind, and to do away the guilt that we have not done enough for our loved ones. But now that facility, that opportunity is taken away. We are unable to perform. Even in a Shraddha, we only have 20 or so close family members. If the extended family members could not come and participate, even the very close friends are also not invited. So that is increasing the grief. But we have to accept, as I said, the reality. This is not the normal time. This is a new normal. So we have to accept the norms, and we should give our enough sacrifice or enough. We call it yog, means wishing well for the departed soul. So the degree of this yog, that wishing well for our departed, should be increased in terms of depth and in terms of duration. So there will be a little bit of healing sensation or healing activity during this time. And also we should accept that it is not only my beloved one, but most of them during this pandemic are like this. Even the so-called well-to-do families, that renowned personalities are also having the same situation. So that is some tips about grief. And this earlier, friends and family members used to come and console. Now we can do the same thing through phone and WhatsApp and message and video calls. And that will be very helpful. Ventilating our grief with our friends, sharing our worries and sorrows with our family members, that will be a very good one. Number 2, monitoring the mental health during this pandemic. So I have given, if this is being recorded, if you replay, that I have given some indicators of stress, physical, emotional, behavioral, and psychological. Those things will be telling you that you are having some, you are going to have some problem, like physical irritability, loss of sleep, and then emotionally lack of concentration, irritability, cognitive, that forgetfulness, and behavior, that irritable, aggressive, sleeplessness. All those things are the indicators. And in short, if you are not happy, and if you are anxious, if you are worried, and if you feel that everything is hopeless, and if you feel that nothing is going to please me, everything is very dull, and I don't like to live, I cannot enjoy, that is an indicator of your mental health. So if that is a case, first you talk to your close friends and relatives. If that does not help, then you have to seek professional help. And the last one is, how much is physical workout is sufficient. During the normal time also, 30 minutes a day are sufficient for common people. But if you are health strict, you want to do something better than the other individuals, you can extend to 1 hour per day also. And you can do aerobic, and you can consult one specialist in this line, and you sweat out. And of course, if you are doing this type of little heavy exercise, you have to think of your diet also, because you will burn away the energy. And if you are not replacing it, then it will do more harm than help. So how much, I'm not an expert, but minimum we should have some movement, and we have to do away with the sedentary nature. We are so sedentary now. It is a sort of a pandemic. All the people are sedentary except in the rural areas where they go for gardening and the field work. Thank you.
Yeah, thank you, sir. Next, we have one question from Narem Dinesh Singh. He said that, good afternoon, one and all present here. We all going through a lot of
Good afternoon.
first phase, second phase. Imagine if the third phase is happening, then what kind of suggestion or awareness given to the public?
Okay, very nice. We have come across First World War. We have come across Second World War. What precaution we are supposed to do for the Third World War? In the Third World War, one button will do away one continent. So what we are supposed to do? It all comes to the mind. You have to calm down the leaders. If the leaders are not leaders are trigger happy, then we will soon have a Third World War. So now we have first pandemic. Now we are facing the second pandemic. So people are talking about the third pandemic, and the one which comes later are more severe and the more fatal. So people are now openly talking about the severity and the mortality rate, which is very high in India, is because we were complacent and we have not taken proper care by the individuals as well as by the government. I am not sure about it. I just narrate what I overheard. But some truth is also there, that we have to be very, very cautious. It is a war of 1.5 billion people. And in Manipur, it is a war of 30 or 33 lakh people. So if each of us are taking up the precautions, that keeping our mind healthy, keeping our body healthy, and following the SOP, even though the number of positive people goes down to 0, even though the mortality rate goes down to very low, even then, if we continue this SOP, then it will always be a preparation for whatever the third wave or fourth wave, if it at all it comes. But after the first wave, you will agree with me that people were so complacent that as if we are completely normal, and we drove our guard, and we were doing whatever we like. In some states, they go for cinema, theater, this and that, because they are also considering the economic loss. They are also considering the educational disturbances and all that. But now we must learn a lesson that if you survive, education can wait. If you survive, your recreation can wait, or you can have a different form of recreation, or you can have a different form of education. So first thing is survival. So the next lesson, I think everyone should know that he or she is responsible for his or her survival. That is a tips, I think, from my side. Other people will give different tips, but from my side, you are responsible for your survival. So let's keep it in mind and act accordingly. Thank you.
There's one question from Khongbai Lakpam Vijayarani. Doctor, you talk about mindfulness and positive thinking. In this regard, how to rewire the subconscious mind who has been traumatized with negative thoughts for decades?
Very good question. Who is not traumatized by negative thoughts? That is the first question from my side. We have around estimated 30,000 thoughts per day, and on an average. Out of these 30,000 thoughts, around 90% are neutral thoughts or useless thoughts. And about 10% are negative thoughts. He is not bad, he is not good, he does not love me, my mother loves my sister more, and my in-law is so bad, and my husband has an affair, and so on and so forth. Negative thoughts are there. Only positive thought, maybe 1%, 2% in a day. And another thing is that our mind is compared with a monkey mind. Monkey always travels in the wood from one branch to another. They don't stay for a minute also. So that is the nature of our thought. So everybody, majority of the people have predominant negative thoughts. So we have to rewire, all of us, whether we are sick or not, whether it is pandemic or not, if we want to be happy. But if we asked everyone, do you want to be happy? Then first answer will be yes, yes, I want to be happy. But they themselves are not doing things which make them happy. They themselves are the culprit. They will think bad of themselves. They will despise themselves. They will not love themselves. They will think that the other person is better. The other person is more beautiful. Other person is achieving more than him or her. So that destroys the happiness that is so rare in this world. So don't kill your happiness by yourself. That is rewiring what you said. This is not very difficult. Consciously you have to try, but distractors will be so many. So you have to fight with all these distractors. So mindfulness or meditations are some of the tools that will bring us back from the past as well as from pull us back from the future. So if we keep on thinking about the past, regret, mistakes, guilt, that we will never become happy. And from the past, what we can do is we learn. And what you can give to the past is forgiveness. You learn and forgive is from the past. For the future, please don't bother. Why I said please don't bother? If you do good now, that your future is definitely good. Definitely it will be good. So you try to dwell on now and here. That is called mindfulness. We are living either in the past or we are living either in the future. And the most important time available to you, that is now and here, is being spoiled by worrying. So from where the happiness will come? Happiness will fly away like a vapor. So if you want to catch them, give them some room to stay with you. They are coming every moment, the happiness, but you are always not giving enough room for them. You are occupying your mind with the past and with the future. So please rewire and cut off those past and future. Live in the present and here. Now also, I think you are smiling. So please continue that smile. That is called happiness, and that is called rewiring.
Below, how many questions are left now?
So only one question. I will pick up last question from Mayang Lambam Vanita Devi. How will we motivate ourselves in this hard situation to reduce anxiety and stress?
Okay, Vanita, I'm told that it is the last question. And I think it can be a concluding remark as well.
Thank you.
Nowadays, it is the time for demotivation. It is a time for desperate thoughts. It is the time for worry. It is the time for hopelessness. It is a time for blaming other people. They have not planned enough. They have not buy enough medicine. They don't create enough hospital. How can we create when we are starving? How can we create a 5-story building? That is also another story. Means we are living in a poor country, poor state. And even our family, we are not satisfied of our administration in our own family. Even just now I just narrated that we are not happy with ourselves. So everything should come from ourselves and everything should come from inside, not from outside. So grassroots level upwards, not up down. From down, we have to grow. Not from top down. That is the administration. Many people talk about top down theory. Now it is from down up to top. That means we have to start with each individual. Whether we are fighting the pandemic or we are trying for a happy life or we are trying for a happy state like Bhutan. Everybody has to be happy. So we are the units of our state. We are the units of happiness. So now we are so demotivated. So what will motivate you? It depends on your goal. It depends on your choice. It depends on your ambition. But at this point of time, the motivation should be nothing but survival. As I said again, harsh motivation of today is survival. If we survive, everything will come. So for survival, what we are supposed to do? We have to eat, we have to drink, we have to sleep, and we have to relax, and we have to do exercise, and we have to do some household work, and we should prepare for our food and our children, and we have to make our family cohesive, and we have to live as a unit in our family. So that will be the basic motivation today, and we should find out those things which are against this motivation. That means worries, infodemics, and unnecessary news, informations, then the risks of exposure, then not keeping ourselves protected, like masks, how to use masks properly, and we have to concentrate on these small things. And the recreation hobbies are the most cherished tools for keeping our mind up, our chin up these days. So rely on that music, rely on your literature, rely on your painting skills, rely on your pets, rely on your garden flowers and then fruit. And these are the simple things. It is a time to go back to nature. It is we have gone too far away from the nature, and that is the fault that is the fruit we are having now. Now we are going back to our roots. Now we are going back to the nature. Please look around your house, look around your garden, look around your this thing, home, that you will see lots of beautiful things, the moons, the sun, the stars, the blue sky, the big trees, the small plants. These are the motivation of today. There is no other motivation like skyscrapers, that very costly cars, and then jewelries, 5 kg jewelries on its ears. That will not do this time. This time is time for survival, time for hope, time for helping each other. So I think Banita might not agree with me at the face value, but please think over a steaming cup of coffee, and I hope you will agree with me. With these few words, I think the questions are over, sir.
I think so. I think so. This last that was the last question. But there is another question from Valentina, but we can it is already answered by the speakers. I think,
what is the question? What is the question, sir?
You have been handling homologous numbers of patients with stressful situation. How do you handle work-life balance?
Okay.
That is from Valentina now. I think this is already answered. This is already answered.
I will be happy to answer Valentina. Valentina is worrying and wondering about me, and I will tell Valentina that I am also struggling because because the
Okay,
worst thing for
okay,
professional is to balance between the personal life and professional life. Valentina
right,
might
right,
also be a lecturer or professor, then she might be facing the same. So we have to
right,
take two roles, especially the women. They have the role of a woman in the family, mother, wife, sister, sister-in-law, daughter-in-law. In the office and in the university, they are supposed to take the role of a professional, the lecturer or a professor. So sometimes the official work takes more time. Sometimes the family takes more time, especially when the children are sick. So there are lots of conflicts. So same thing is happening with me also. But with this theoretical knowledge and little bit of practical this thing, execution, I am trying to survive till now, Valentina, and you will also succeed. Be happy, be cheerful, be safe, and it is a time for survival once again. And hope will be the most important tool, and the army will be yourself. Nobody will come and tell you or save you.
that's
You will save yourself. Thank you very much. And this
okay.
is an opportunity I enjoyed, and hope little bit of this thing tips will be helpful to someone amongst the whole lot who has listened to me carefully and attentively. Thank you so much for giving me this opportunity, sir.
Okay. So, Dr. Santosh, may I speak something?
Please, sir, please, sir.
Okay, okay. So before the concluding remark of from the convener of this talk series, being a moderator of this today's session, so I would like to thank Dr. Lenin for your excellent talk. So you have started from what is stress and what are the signs of the stress, what are the factors or region of the stress, and how do we cope up with the stress. So we explain in a very right manners. So we are very much highlighted and enlightened. So we have learned a lot of information from you. And so once again, I thank Dr. Lenin. So
Thank you, sir.
being a student of philosophy, I remember some problems which we have discussed for the last century regarding the distinction between mind and the matter, body and the mind. So I remember when one French philosopher, René Descartes, he said that body and mind are independent entities. So body has its own world and mind also its own world. They are not, they are inseparable, not separable. They are separable in one way. So these, so when we have some problem when we endure in body, so it naturally reflect on the mind also. Mind has we feel pain simultaneously when we have some injure in mind, so it is also reflected in the body. So this mind body dichotomy is debunked by another professor from the British professor of philosophy, Gilbert Ryle. So he refute the official doctrines of Descartes, the mind-body dichotomy. So there is no substance called mind. So it is something like your feeling, emotions, and the internal state of mind is something dispositional. So it is talk about the internal mind is talk about the in terms of the behavioral. So we can call it the behavioral approach. So in the as a student of philosophy, I would like to summarize the whole talk in 2 lines. So in this talk, Professor Lenin explained everything. But from this, in my understanding of these lectures, so there is a problem of the perception. The perception problem, epistemic problem is the main role of this mental problems, so to say, mental state of disorders. So in the lectures, Doctor rightly pointed out a very beautiful examples of the glass of waters. So when we ask to somebody, so the water, the glass half-filled waters. So how much of water is contained in the water? Some people may say that it is half empty. Some people may answer that it is half filled. So that depends on their perceptual problem. So we must have these. Most of the mental stress is related with our perceptual problem. How do we the positive attitude towards the phenomena, positive attitude toward the surroundings, the positive attitude toward the world. So we have to inculcate the positive attitude. So we have to face. We cannot escape from this world. So whatever it may be, pandemic, COVID pandemic, whatever it may be, any sort of disaster. So we cannot escape from this. We have to face it. So in order to face all these things, we have to prepare our mindset. That mindset can be developed. The good mindset, a positive mindset can be developed when we have a positive outlook, a positive attitude towards the people, towards the surrounding, towards the nature, so and so. So I would like to thank once again. So I don't have any comment to say the comment regarding the whole lectures. I was not trained in this medical field. So once again, I would like to thank the Dr. Lenin for your nice, excellent talk. Thank you. Thank you.
Thank you.
Thank you.
Thank you, sir. It's a very really fruitful presentation and discussions regarding the stress management during the pandemic. Everyone get knowledge from the doctor how we can manage your stress, depressions, everything whatever we have facing during the pandemic. Thank you so much. So let me speak only one line in Manipuri in the streams live of the Mami TV. Some questions khara Manipuri dagi hangbirakpa makoy yam interest lay na doctor da akoy organizer da haibirakpa si Dr. Manipur University na asigumba topic asida same topic da same resource person na Manipuri language da amuktanga sindi raga de koy hainingai leitana thagat jagani tawiman su kauba leijaroi punsigo ina haina Mami TV live ki so dagi comment mayam same comment mayam lakri hojik so koy na pazari haibadi mayam sina hojik Manipuri sigi hojik ki ngangbi riba topic sida same language sida Manipuri da ngangbi ragadi akoi yamna nungaijagani haibagi comment ama pisari doctor. Thank you so much. We if you have time we'll invite you again in Manipuri. Thank you.
Sure. I'll be very happy.
Thank you, sir. So coming to the conclusion parts, so let me propose a vote of thanks on behalf of organizing committee, Fit India Campaign Committee and Fit India Club of the Manipur University. We like to propose very sincere for the heart of the thanks to the speaker, Dr. Lenin, for your sharing your valuable time, for sharing your knowledge and everything in this short period of the time. Everyone is happy. Thank you so much, sir, for your valuable sharing your time over here. Thank you so much. And I thanks to the moderator, Dr. L. Biswanath Sharma, co-moderator, Dr. S. Sanjay Kumar Singh. Thank you so much for handling and smoothly controlling our session. Grand success. Thank you, moderator and co-moderator. Thank you so much. And thank you all the viewers and the listeners and all the participants, teaching staff, non-teaching staff, learned member, all the students over here presenting for this session. I thanks from the bottom of my heart from our Fit India Campaign Committee and Fit India Club. Thank you so much. And I thanks our Mami TV also for from still to sharing all the thought and the presentation to the live stream. Thank you so much, Mami TV also. So next session, next episode, 4th June 2021, very topic, good topic will coming up nutrition self-management, how we can manage the nutrition during the pandemic. That speaker will come from Bangalore. So we'll meet you again together on that 24th June 2021. See you, all of you, all the participants, all the panelists, everyone again. Have a nice day. Thank you. Thank you so much. Thank you. Thank you.
Thank you very much.
The person